now. I think we're on. Okay. So nice to have you all here. What I thought we'd do is I thought we would build on the speaking that we did yesterday when we were talking about responding in class. I thought the empathy thing was interesting. So I've got some more examples for us to have a look at there. And I'm going to do a role play as well. So I'm going to choose one lucky person from this group, and you're going to do a role play with me. So obviously we've got people on Facebook watching as well. Yeah, okay, if you've got any questions or if you've got anything that you want to say, just post it in the box, and we'll be happy to answer. I think this is probably going to be about 30 minutes, something like that. So hopefully I'll be able to do some bad speaking, and you guys will be able to pick up what the problems are, and then we'll do some good speaking, and we'll get some of you guys experimenting with showing some empathy, I think. So first of all, let me just here it is. This is what we're doing. We're doing responding. We're doing OET speaking. Now, just remind me again, anybody here, what is responding? I know it sounds simple, but what do I mean when I talk about responding in OET speaking? Any ideas?
That I'm involving the other one in the conversation, and I'm following and also giving like a kind of feedback on the conversation.
Yeah, when you have a conversation, you continually give feedback, don't you?
Yes.
Yeah, it could be nodding, or it could be, ooh, or it could be, oh, or it could be, yeah. Yeah, so there's loads of different things. So we'll go through those very quickly. But if we think about OET speaking from a criteria perspective, from an examination perspective, responding is active listening. That is also a way of incorporating the patient's perspective, okay? Showing that you're listening. And also, quite often, it's not just a case of, yes, I'm listening. It's, I've got something to say, which is in response to what you said to me. Okay, so what are your plans for the weekend, Laura?
I might go back to the woods on my bike.
Okay, I ate a banana yesterday.
Oh, really?
Yeah.
Oh, that's nice. I like bananas as well.
Yeah, the weather's good, isn't it?
Well, not as good in here. Can I just ask you something while we're talking about random stuffs?
Yeah. Yeah, I'm thinking of buying a car.
Nice. I hope you can find a good one.
So that's a hard thing to keep up with, isn't it? I should be answering what you say to me. I should be saying something back.
Yeah.
Oh, really? You're going to go to the woods? So you've been before?
Yes, I've been before.
Oh, right. Okay. So do you like cycling?
Yes, I'm just back because I had an accident like 3 weeks ago.
Oh, I'm sorry to hear that.
Thank you. But fortunately, everything was all right, and it wasn't something severe.
Were you wearing a helmet?
Yes, if I wasn't wearing that helmet, probably I wouldn't be telling my history. The helmet,
I see.
It was completely destroyed, and I knocked myself out. But I'm ready to go back.
Wow. Okay, you're ready to get back on the bike.
Yes.
Okay, I see. All right. Okay, so that's a conversation, isn't it? You say something, I say something, you say something about what I said, I make noises and say, Okay, it's something that we all do all the time, but maybe when we're nervous or we're under pressure in the OET exam, it's something that we don't remember to do. So let's do some of that. Let's try and bring that into an OET setting. So I'm going to choose Baiju. Are you there, Baiju? Okay, Baiju. Have a look at the screen. Okay. Now you're here. Okay, you're the parent of a child.
Okay.
Who's had a seizure for the first time earlier today. You've been told it's epilepsy, but you're confused about the situation. You would be, wouldn't you? Yep. You know, if it was the first time and you didn't know anything about it. Okay. So I'm going to be just a healthcare professional.
Okay.
And I'm just going to be giving you some information, supporting you. So these are the things that you need to do. Okay. All right. You need to find out what epilepsy is. You need to say you're worried about the future. You say you don't know what signs to look for in case of future seizures, and ask if there's any other help available.
Okay. Sure.
Okay. No, we're not gonna take too long to do it, but okay. Hi there. My name's Paul. Can I just confirm your name?
Hello, Paul. My name is Baiju.
Baiju. Oh, hi, Baiju. Okay. How can I help you today?
Paul, my daughter had a seizure today morning, and I'm quite worried, because actually I don't know why it has happened for her. It's all came suddenly. So I am very confused about the situations, and I don't know. I'm very scary too.
Do you know what epilepsy is?
No, I'm sorry. I don't know.
Epilepsy is when signals in the brain don't work properly. And when they don't work properly, it makes the body react badly, and it can result in children or adults sort of shaking on the floor and having seizures. And they don't last very long, and they're normally not too serious, but it can be a bit frightening.
Oh, okay. It's like that. Oh, I understand now. Okay. If there is any chance it will come later?
It is possible. Yes.
Oh,
You will be okay.
okay.
All
So,
right. So wait there, Baiju. Tell me, everyone, how am I doing? Am I doing a good job?
Lack of sympathy, lack of empathy.
How dare you, Sabrina? Yeah,
Yes.
it's absolutely right, isn't it?
Yes. You were like,
I'm not.
oh, okay.
Yeah. I just said, do you know what epilepsy is? That's not good, is it? I'm not responding with warmth. I'm not giving any kind of empathy.
Yeah,
I'm
and
not giving. Yeah, go on.
he also said that he was worried and he was scared, and
Exactly.
you didn't even
What
consider that. He was like, oh, okay.
Empathy.
No, all I cared about was doing my job. That's it. I saw my job as doing what was on this card, and that's it. But that's not enough, is it? So, Baiju, let's start again, okay? I promise I'll be nicer this time.
okay, sir.
Okay, let's start again. Hi, my name's Paul. Can I just confirm your name?
Hello, Paul. My name is Baiju.
Hi, Baiju. How are you today?
I'm good, Paul. But my baby had a seizure today morning,
Oh.
and I am very worried because it
Mhm.
happened suddenly, and I don't know why it happened for her like that.
Okay, I'm really sorry to hear that. Okay, right. Okay, so, well, what we'll have to do is let's have a chat about that. You can tell me a bit more about it, and then let's talk about how we can manage it. Okay?
Okay.
All right. Okay, so what do you know about epilepsy?
Actually, I don't know anything about epilepsy.
Okay, don't worry about that. I can tell you everything that you need to know about it. Okay, so inside the brain, there are signals that go from one part to another, you know, when you're having thoughts and sending messages to the body, and sometimes they get disrupted. Does that make sense?
Yeah.
Okay, well, when they get disrupted, unfortunately, the body doesn't really react very well to that. And you can find that your child, or, you know, if you're an adult, it can be anybody, you can just have seizures. And I think that that's what happened to your daughter. Okay.
Okay.
All right.
Okay.
Okay. So I can see you're worried.
Yeah.
And I understand that. It must be a difficult thing to hear.
Yes, Paul. Yes, Paul. Yeah, I understand now, why what the epilepsy is.
Okay.
I have a question. Is there any chance it will come later, in future?
Yes, very probably. Okay. It's not necessarily going to get worse, but it is something that we should expect could happen again in the future. Okay.
Okay. So, if it happen again in future, so what I should look like? If there is any specific
Well,
thing?
let's stop there, Baiju. Okay, brilliant, Baiju. Excellent acting. Thank you very much. Okay, so that time it was a lot better. Okay, what kind of things did I do that time?
Show more empathy.
Listening, showing empathy.
Yeah, there was a lot of empathy there, wasn't there? Was the empathy suitable?
Just one thing, I noticed that you have you told him does that make sense?
Okay, yeah. Okay, you're not happy with that clarification question?
Actually, my supervisor always used that sentence, like, does it make sense?
Mm-hmm.
Do you understand what I mean? Those things. So do you think these are okay?
Yeah, I think it's okay, but as we'll explore in a moment when we have a look at that document that I've got, a tone of voice is so important, isn't it? So if I said, does that make sense? That feels really aggressive, doesn't it? It's like the other thing didn't make sense. So you sure you're going to be able to understand this one? So I think that's an okay phrase, but tone of voice is everything. Does that make sense? Is that
Okay.
clear? How does that sound? That's not what we're here to discuss today. It's a good point, but okay, I was saying okay, okay, I can see you're worried. Lots of things that made that parent feel like I was there to help. Not just there, I'm not just there in the speaking test to do my points on a card. I was there in a real dialogue with this person. So we're just going to revisit some of the things we said yesterday. I just want to see if you can remember what we said about these things. Can you remember? Okay,
Yeah.
so we saw all these yesterday. What does this one mean, Sabrina?
This like active listening, like you
Okay.
are listening and responding. Okay.
Okay, I'm actively listening. But there's a difference between and isn't there?
Yeah, like that means like okay, understand these things, and kind of like okay, you can go on. I'm listening.
Yeah, okay, yeah. Basically, you're saying I'm listening with this one for sure. For me, this one,
And it's like I'm thinking.
yeah, I'm thinking about that. That's how that feels to me. This is it's not a science, but this is what it means to me. If I say something and they say I know that they're listening to me, and I know that they're thinking about what I just said. Okay, I imagine. Have you ever seen those? It might be in a comedy or something where a psychiatrist is listening to someone who's saying, "Oh, when I was a child, my mum did this," and he's going, but really he's just drawing a picture on his paper. Yeah. So that noise, it makes it sound like you're thinking about it. Like that is just, I'm listening to you. Keep going. This is great. This is fine. Okay. Now I'm going to put down a few different things here. If you remember, there's different ways of saying it. So what can okay mean again?
Right.
Right.
It can mean okay. Okay. Yeah, I heard that. I heard and understood that. Yeah. Anything else it can mean? Okay.
Here's a question. Is that all?
Am I clear
Yeah.
to you?
Yeah. Is that okay? Did you understand? Is that clear, or is that fine? Is that good? I suppose you could say. Yeah. Is that clear? Is it good? Okay. What am I doing then? If I say okay.
You are just about to start a new topic, so it's
Yeah.
like a pause.
Exactly. Yeah. So I'm ending one topic and
Yeah.
starting a new one. Oops, not starting a new one. Okay, so okay, let's move on. Let's look at right. Now, right is pretty much the same thing, isn't it? Same as this one. Right, okay. It can be ending one topic and starting a new one. It can be, I understand. Right. Okay. Yeah, so that's a good one. That's nice as well. So let's put in this one here. And I don't know why it seems to have squeezed in. There we go. We can move that over there. Okay, good. Okay, and then what else did we have? We had I see. I see. Now we've got different ways of saying that. I see and I see. So what's I see? What does that do for us?
It could be like that. I'm thinking.
Okay,
I see.
okay, I understand that.
Yeah, I understand that. I understand that. It's almost to say, yeah, that's clear to me. I see. Okay. Yeah. And you often put a lot of these things together. Okay. Yeah, I see. Right. Okay. You often use those phrases. They're just the small bits that if you looked in the dictionary, you wouldn't find them. Somebody brought up echoing yesterday, which I thought was really good. Okay. So what do we mean by echoing?
Repeating what
The phrase
the
of
patient
Yeah.
already said.
So if I give you a long description, would you repeat every single word of it?
No.
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 Some
Yeah.
Paraphrase.
You repeat
words.
the key phrase, don't you? The
Key
key
phrase,
phrase of it. Yeah, exactly. So repeating the key phrase. And okay, how about fine? Because that could be said in lots of different ways. Fine.
It's okay.
I don't need to say it like that though, do I? Fine.
No, because it sounds like if you were
Rude.
upset or cross, like rude.
Yeah, it sounds like I'm going to slam the door and walk out. Yeah. Okay, you have it your way. Fine. I don't want that. I want fine. Okay, so fine. I'm just saying that's okay. That's okay. And it almost feels like I'm bringing that to an end, that we've said what we need to say about that. Fine. Okay, let's go and do something different. So first of all, we've got these, I don't know whether to call them non-verbal really, but they're not words generally. They're just noises that are reassuring to the listener. They make the listener, sorry, they make the speaker feel like they're being listened to. And that is so important. You know, as we said before with Baiju, he was saying stuff to me. I was just waiting, saying nothing with my face. We call it a poker face from the Lady Gaga song. And I was just sitting like that. Do you know about epilepsy? Oh, that's not very good, is it? We don't want that. So empathy and showing that you're listening, those are really important things to make someone feel. What would you feel like doing if you feel like the person in front of you understands how you feel and is listening to you?
You feel more comfortable, so you probably will open a little bit more.
Yeah, you don't mind appearing vulnerable or telling the truth about something which is sensitive. You know, just imagine it was something like, because sometimes you do get sensitive matters in these OET things. It could be about sexual history. It could be about weight. It could be about drug use, things that you don't generally talk to people about. And, you know, you certainly wouldn't talk to a stranger about. So showing empathy, showing that you're listening, being able to respond well in a positive way that says, yeah, I understand what you're saying. Let's do something else. You put that together with signposting, like I did with Baiju. I said, okay, don't worry about that. We're going to talk about that now, and then we'll discuss some treatment. That made the listener think, this person is listening to me. He's ready to move with me through this conversation. I think he felt comfortable to tell me stuff. Okay, so empathy. Now, yesterday I had a lot of phrases here and lots of different things down here. Now, I've got some new ones, guys. Okay, I've got some new ones here. So we've got some phrases over here. Okay, we've got some phrases over here. I can see this is a difficult time for you. I know it can be challenging to, and that could be an activity then or a verb. I know it can be challenging to switch from one medication to another. I'm sorry to hear that. I think yesterday that was probably our greatest hit, wasn't it? I'm sorry to hear that. And it can be used for different things depending on your tone of voice.
Yes.
Yeah.
So if we listen to with a difference, I'm sorry to hear that, or oh, I'm sorry to hear that, or I'm sorry to hear that. They're all very different. Okay, the tone of voice makes the difference. If it's a really serious issue, and I say, I'm sorry to hear that. Why? What is different? If you think about it practically, what's different between that and, oh, I'm sorry to hear that?
That it's not the appropriate way to tell for
I know,
the...
but physically, what's the difference between
The
those
first
two?
one had more empathy.
Okay, but how did I do it? It didn't have more empathy because of different words. Why did it have more empathy?
The tone.
Because you
No.
shown that
Tone
you
of
care.
language.
It comes from a deeper place, doesn't it? So you can hear what happens. It goes down here into my throat. I think I'm sorry to hear that. It's really deep. It's as deep as I can go. I think that's what most people do when they're giving reassurance or empathy about something which is super serious. You go deep with it. You don't go up with it. When you're going up with it, you're sort of inferring to the listener that, okay, I'm going to take it this seriously, not this seriously down here. So it's not just the tone, though. Something else happens. Okay, listen again. I'll do the both of them. I'm sorry to hear that. And, oh, I'm sorry to hear that. What else happens?
There's a little pause.
The pace is
as
different.
well.
Pace is different. It's
Yeah.
slower, isn't it? Oh, I'm sorry to hear that. It becomes and it's almost like it's not really, I don't really feel that sorry. So I'm saying it faster, but I'm sorry to hear that. It's slow. I want you to hear that. And I really want you to know that I feel what you're feeling. So it's a very good phrase. The tone of voice changes everything. Also, if I said, I'm really sorry to hear that. Well, that's a bit different, isn't it? That's almost like you'd say that to a friend if their dog died. because you don't want your friend to be upset. You're probably going to put your arm around them. You're probably going to have a cry together because it's a personal issue for you as well. But it's not a personal issue for you if you're a doctor or a nurse dealing with someone who's had sad news. It's not personal. You've got to be professional about it. So let's leave that really out of there. Okay. I understand it's frustrating when, I can understand why you'd be worried about that. If I were you, I'd feel the same. We've got Alan's famous phrase here. I can only imagine what you are going through. I know you're going through a tough time. So what's the difference between those two? I know you were going through a tough time, and I can only imagine what you were going through.
Because I'm not going through that situation, so how could I understand or how could I know that?
Yeah, you not quite.
I think you have experienced one,
Yeah.
and you haven't experienced the other.
Yeah,
So-
I think with this one, what we're saying is, look, I haven't had cancer, so I respect that you're in a situation that I'm never been in. So I can't say that I know how you feel exactly. I'm giving you that respect. So that really, it's a really nice phrase. I like it, but we can't use that in all situations, and we'll have a look at that. So it must be tough. It must be difficult. I can see you're worried. So something like, I can only imagine what you were going through. Now, if we think about it, let's have a look at some things here. Are there any things here that might be common? I'm not sure how many are common there. Some of them are very uncommon, but at least one of them is very common. Look at these things.
It's
over
really
here.
common. I haven't been feeling well recently. That's
Yeah.
something that you probably will have quite
Everyone in this class has said that, haven't they?
Yes.
Yeah. Or, oh, I don't feel well today. Okay. So they might be hiding something. They might eventually say, I've got a big lump in my neck and I've been vomiting all the time, but you wouldn't normally say that as the opening phrase. I haven't been feeling well recently. That's the kind of thing that you wouldn't say. I can only imagine what you're going through.
I burned my hands.
I burned my hands with hot fat and now I can't do any of my normal activities. That's quite extreme. I think it's quite extreme. That actually happened to a friend of mine. He didn't realize that his mum had just been cooking roast potatoes in the oven, and she closed the oven with the pan inside with the fat.
Yeah.
And he reached up and he pulled it out like this, and the hot fat went all over his arms. Oh, terrible injury. Yeah. So I think that's quite extreme, but it could be I've burnt my tongue. Sometimes when you're tasting food before you eat it, and you burn your tongue and then you can't enjoy the meal. Oh, so annoying. Yeah, okay, so that's the kind of thing that can happen. I think the rest of these are quite extreme, aren't they? But some of them are conditions. Some of them relate to treatment. Some of them relate to just situations in your life. So let's look at I'm in agony. I think I've slipped a disc. Okay, so I'm in agony. I think I've slipped a disc. So what is agony? What does that relate to?
Pain, excruciating pain.
Yeah, excruciating pain, extreme pain. On a scale of 1 to 10, where do you think agony is?
12.
12, yeah. It's 11 out of 10, yeah. Yeah, so it's right at the top, isn't it? But if you think about it, it seems we've got something called hyperbole. Have you ever heard of hyperbole?
Yeah.
Something overstated.
Well, you're overstated.
Overestimated.
The example I always use is, I'm starving. I'm not starving.
Exaggerating.
You're not starving, you're hungry.
I'm exaggerating.
But
So this person, I think I've slipped a disc. I'm in agony. I don't quite believe them. Okay, it's painful, no doubt. It is painful, but it's not the same as having your leg chopped off, is it, in a car crash? I know it's painful, but I think it might be a little bit of exaggeration here. But anyway, let's have a look. I'm in agony. I think I've slipped a disc. What do you think you'd say over here?
I can see you are worried.
Yeah, I can see you're worried. They're not really worried, are they?
I can see you're in pain, but we're going to do everything to help you to control
I suppose,
this.
yeah, I can see you're in pain. Yeah, I suppose that's not so much empathy, but it's acknowledgement, isn't it? So these two here, I think, are acknowledgement of, I agree with what you think of the situation. Yeah, so I can see you're in pain. That's a good one. Are there any others? I'm sorry to hear that, I think would be a good one.
Yeah.
Yeah. So think about how we would say it. It's somewhere in the middle of the two I said before. So, oh, I'm sorry to hear that. It's not the same as, oh, I'm sorry to hear that. It's not like that one. It's, oh, I'm sorry to hear that. And maybe with your eyebrows, they go down a little bit as well. Oh, I'm sorry to hear that. So many things go together to expressing empathy. What about if I were you, I'd feel the same?
No.
No.
I don't think so.
I don't think that one works.
How about this one? I know it can be challenging.
No, not yet.
No.
Do you not think?
Painful.
I know what you mean about I know what you mean about challenging. It seems to be that there's a challenge, there's an obstacle, but it can be challenging if you slipped a disc, I think. I mean, I know that someone in my family, it used to happen to them sometimes, and they couldn't do anything. They would just have to lie on the couch for 2 days until it seemed to be better. So maybe challenging, but I know it can be painful. Oh, I like that. I don't know who it was who said that, but that's a good one.
Sabrina.
Yeah, Sabrina, I know it can be painful when. Now, that's a nice response, isn't it? I know it can be painful when. That's a good one. Okay, how about the next one? I have a metallic taste in my mouth.
I'm sorry to hear that.
So I'm sorry to hear that. Could be there. It's not very extreme, though, is it?
No.
It's normally it would be a symptom maybe of some other situation like COVID-19, I think was one of them. Pregnancy, I think it can be something which is associated with that. What else could it be associated with? Metallic taste in the mouth.
Having some medicine, some particular medicines can cause.
Particular medicine could do that. Did someone say an ulcer?
Yeah.
An ulcer. Okay. It doesn't.
Bleeding.
Some bleeding. Yeah. Okay. So maybe some gum disease, possibly something like that. It doesn't feel very serious, does it? You know, it on its own, having a metallic taste is not, it's annoying, but it's not a serious medical complaint. I'm thinking something like this, though.
Yeah, or I know it must be uncomfortable for you.
Yeah, I know it must be, or it must be unpleasant. Yeah, we can put
Awful.
that. It must be awful. That's a bit strong, isn't it? It's a bit, I know it must be awful. No, I don't think it's awful, but it must be unpleasant.
Okay.
Yeah, it must be annoying as well, would be a good one. Yeah, we could do that. So this one, though, I think is good because you know what you'd be, if someone came to you and said, I have a metallic taste in my mouth, and they were really worried, all of you guys would probably think, I've seen more serious things. This person's really worried. I'm going to try and make them feel like they're important, that this is important. But in your mind, you're probably thinking, okay, well, it's not that awful. It's not that difficult to deal with. So what you can do is you can put that back over to them. I can understand why you'd be worried about that. Like, what does it really mean? It doesn't mean that you're worried about it.
No.
But I can understand why you might be, because that person, maybe they've never had a metallic taste in their mouth before, and it makes them think something serious could be wrong. You know what happens. I don't know I think some of you have met my mom in the everyday English, but if she had a metallic taste in her mouth, her first thought would be, it's cancer. That's what she.
That's Petrina, yes.
Yeah, and she'd be straight to the doctors. I've never had this before. Am I going to die? This is serious, and the doctor always has to deal with her. So, does anyone know what this word means? I think we've talked about this before.
Yes.
What is that?
Some minor symptom is some serious disease.
Yeah, you keep thinking that there's something seriously wrong with you, even though there's nothing medically wrong with you at all. So maybe that's the situation. Okay, so that's nice. Okay, now how about this next one? My son has recently been diagnosed with autism, and I'm worried about his future.
I can see you are worried.
Yeah, I can see you're worried. I think that's a good one. Yeah.
Why you would be worried about that?
I can understand why you'd be worried. Yeah, so I'm on your side. I get that.
I can see this is a difficult time for you.
I can see this is a difficult time for you. Yeah. Yeah, I mean, no one wants to hear something like that.
Well, I know it can be challenging too.
Yeah, how about it must be difficult?
Yeah.
Yeah, it must be difficult to hear something like that.
I can only imagine what you are going through.
I suppose, but the thing is that in this case, I don't know. I think it's a bit too strong. I think it's a bit too strong there, because what we're saying is, if I say to someone, I can only imagine what you're going through, what am I telling them about what I think about their situation?
That the condition is very serious.
Very serious. So we've got to be careful with that. You know, a child being diagnosed with autism, okay, I'm not saying that it's not important, but it's not like they've been diagnosed with a terminal illness. You know, this is something we can live with. This autism is something that people live with, people have good lives with. It's not the end of the world. So to say I can only imagine what you're going through it's almost validating and saying, approving of their really serious reaction to it. So I think we've got to be careful with that.
Okay.
All right. Okay. Good discussion though. Okay. Next one. I hate doing dialysis. Oh, I hate doing it. What do you think?
It's,
If I were you, I would feel the same.
Yeah. If I were you, I'd feel the same. Why not?
Yeah.
Okay. Why not say that? I know it can be challenging.
I know it can be challenging to start a new procedure.
Yeah. I know it can be challenging to keep going to the dialysis every day.
Yeah.
Yeah. I understand it's frustrating, maybe.
Yeah.
When you've got to keep doing the same treatment and you don't feel like you're getting any better. Yeah. I think that they're the ones. I think that they're the ones that I'd probably say there. I think that they're good.
Going through a tough time?
Say that one again. I know you're going through a tough time.
Tough time.
I'm not sure, because I know you're going through a tough time. It gives a feeling of being temporary, doesn't it?
It's not temporary, it's chronic.
Yeah, it's chronic, isn't it? Unless we get a donor. So a tough time, possibly it could be. It possibly could be. You could stretch it to that, but I think the other ones are better. Okay. I have alopecia and I don't want to leave the house. Now that one, I think could be, I know you're going through a tough time, because this person has only recently developed alopecia probably, and they're still not used to it. So psychologically, it's quite.
You are worried.
I can see you're worried, or I can understand why you'd be worried.
Yeah.
It must be difficult. It must be difficult, you know, when you lose your hair. I know it can be challenging. I'm sorry to hear that, possibly as well. Why not? If I were you, I'd feel the same.
Yeah.
I'm not sure you can do that one.
No.
I don't think I'd say that one.
That makes him depressed.
Yeah, it would, wouldn't it? It's like, you know, basically I'm saying if I looked like you, I wouldn't leave the house.
Yes, you are like
You
telling
can't say
them that they should be ashamed in a certain way. So
exactly. What we've got to try and do is avoid.
Encourage him.
Yeah, we've got to avoid this idea that there's something wrong with them. You've got to avoid that, and that they should feel like that. So we're trying to avoid validating those feelings. How about the next one? I burned my hands with hot fat and now I can't do any of my normal activities.
It must be a difficult time for you.
It must be that must be difficult. Yeah, it must be annoying.
I know it can be painful.
It can be painful. I know it can be painful when it's frustrating as well, isn't it? It's not going to last forever, is it?
It's a tough time, I think.
It's a tough time. Yeah, I know it can be challenging when you can't use your hands. I can see this is a difficult time. Yeah, I understand it's frustrating. All of these things, they're sort of giving the idea that this is something that's going to pass. Yeah, you probably wouldn't do that. If someone said to you, I had my hand amputated, you wouldn't say, it must be difficult. Because it's something that they have to live with forever. Yeah. Okay, next one. Next one's a bit of a strange one. I think that there's more of an emotional aspect here for this one. So sometimes I find myself in a room in my house and I don't know why I'm there. So if think about who this is, I'm thinking maybe
Alzheimer's.
Yeah, someone maybe mid 60s, you know, trying to come to terms with something that's
Depression.
changing. There could be some depression there. There could be some dementia.
I'm sorry to hear that.
Yeah, I'm sorry to hear that. Yeah,
I
definitely.
understand it's frustrating.
I can understand why you'd be worried about that.
Yeah, and I really like that tone there, Neshka. Say that again for me, Neshka, the way you said it.
Which one? The last one.
I'm sorry.
I'm sorry to hear that.
I'm sorry to hear that. Yeah, definitely. That's not something to brush over lightly. Oh, I'm sorry to hear that. You know, it's not like they've got a sore fingernail. No, this is serious. This is something that any of us, if any of us found was happening to us, we would be very concerned.
I have so many practice about this every day.
Yeah, I can imagine. Yeah. And do those people think it's funny or light?
No.
It's heavy.
You have to explain maybe 10 times, more than 10 times the same thing.
Oh, good. Yeah. So something like I can only imagine what you're going through. That's not right. We don't want them to focus on the negative here. Again, it must be, I wouldn't do that one. I think something like, I'm sorry to hear that. I understand it's frustrating. I know it can be challenging when this happens. That's good. Okay. And then the last one. My husband had a stroke last week, and he needs a lot of help. I don't think I can cope.
I know it can be
It's
challenging.
very tough time, I think. And
Yeah, I
challenging.
know it can. What's challenging about the situation? How would you say that sentence? I know it can be challenging.
Care about your husband.
I know it can be challenging.
Not to care about. She
Cope.
definitely cares about her husband. To care.
Cope.
To care. What's the
cope up.
preposition? Okay, so I don't want. Okay, yeah, you're absolutely right there, Han. Okay, so you've got care about, care for, and you've got cope. Now, you don't cope up, you cope with. Okay, there's no such thing as cope up. All right. Now, care about means to have feelings of affection for someone or for something or someone. So, Han, tell me something you care about.
I care about my family.
Okay. Yeah, you care about your family. I care about this pen. I've had it for about 2 weeks now. It's still going. Okay. I care about it. Yeah, I want to keep it. I don't want to lose it. But I care for my grandfather. What does that mean?
About person.
Look after them. Look after
Look
him.
after
Yeah,
him.
You
I
look
give
after
care.
him.
I give care to that person I look after.
Okay.
Okay, so these are phrasal verbs. And then you see something like look for. Okay, well, where's my red pen?
I'm looking
Yeah,
for my
I'm
pen.
looking for it. So loads of phrasal verbs, really useful in English, but I don't want to see cope up. Okay, no cope up. Cope with, care for, care about. It's possible that care about could be there. I don't care about anything else. I just want to drink, possibly if you're dealing with someone with addiction problems. Okay, so I know it can be I know it can be difficult or it can be challenging to
cope with.
cope with, yeah,
With
or
this situation.
or to care for a partner. Yeah, is it frustrating?
Not really.
No, really.
That's not the right word, is it?
No.
That's not the right word.
Challenging might be better. But
Challenging's a
I
good one.
understand it's challenging.
I can see.
If I
How about
were you,
this?
I would feel the same maybe.
Possibly, yeah. I mean, I'm putting myself in your shoes. Yeah. If I were you, I'd feel the same. That would be difficult for me to handle as well. Possibly, yeah. But it's not. Is it a tough time? Like I know you're going through a tough time. I suppose you could say that.
Yes.
You wouldn't say I can only imagine. It must be difficult would be a good one again, or tough.
So we can say it's understandable that you are worried about.
But what's she worried about?
Maybe if she say any situations like example, she had a fall or something.
Well, the only time that you'd say it's understandable that you'd be worried is if they tell you that they're worried.
No.
You know, if you say, I can see you're worried, and they confirm it, then you can say, look, it's understandable that you're worried. But in this case, she didn't say she's worried. She's just saying quite clearly, I don't think I can cope. That she might be someone who knows exactly what the situation is and knows it's not, she can't do it. He's heavier than her. They don't have any equipment in the house. She's not worrying. You know, worrying would be something like, he's bigger than me, and what will happen if he falls over? And that's someone worrying. Yeah. So don't bring worry into it unless it's been confirmed that they're worried. All right. Now, for instance, this one, I'm worried about his future. Oh, it's understandable that you'd be worried, but, and that's where we come in next with the advice and suggestions. Okay, so I think we'll leave it there. So we're talking about responding. How can we respond? And obviously there are loads of different ways of responding, but empathy is a really good way. If you combine that with active listening to build that relationship. And then after you've built the relationship, you start providing structure. It's understandable that you're worried about, yeah, it's understandable that you're worried about that, but don't worry. Today, we're going to discuss some steps we can take. Wow, you've done three things there. You've incorporated the patient's perspective, you've built a relationship, and you're providing structure. And then you move on into the rest of the speaking, where you're giving information and gathering information. Okay, super. That's great, guys. Really happy with your contributions there. If anyone on Facebook has got any questions, or you'd like to say anything to us or ask us anything, go and have a look at the old website that we've got, which I've got open somewhere, I'm sure. Yeah, you can go and have a look here at our website. This is our older classes page. But if you go, here's the front page. All you have to do, come here, have a look at OET preparation. We've got all of our packages there. And just leave us a message if you want to contact us, just there. Okay, right, I'm going to finish there. Have a great weekend, everyone. You guys in Zoom, I'll see you in about 18 minutes for some reading part C. All right.
See you later, Ben.
Okay.
See you in a bit.
Thank
Bye-bye,
you.
guys.
Bye. Thank
Bye-bye.
you.
Bye.
Bye-bye. Bye-bye.